My name is Kathy Barnard, and I am the president and the founder of the Save Your Skin Foundation, one of the presenting organizations for this summit. Our generous partners in this endeavor are the Schizophrenia Society of Ontario and the Canadian Cancer Survivor Network. I would like to begin by acknowledging that the land on which we gather is the traditional territory of the Haudenosaunee, the Métis, and most recently, the territory of the Mississaugas of the New Credit First Nations. Today, the meeting place of Toronto, from the Haudenosaunee word Takaranto, is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work and to present in this territory. This year, the over 100 of you in this room represent 53 patient organizations listed here from 6 provinces and 48 observers from other stakeholder groups. You deserve a big round of applause for taking time out of your very busy schedules to come to talk about a complex but ultimately crucial topic for all of those requiring treatments in Canada. That is, the role of the policies, practices, and other regulations relied on by all stakeholders in the areas of drug pricing and drug access. This event really did take a village to organize. First, we would like to thank all our sponsors listed here, starting from our Tier 1 sponsor, Innovative Medicines Canada, and including Pfizer Canada, Eli Lilly, Amgen, AstraZeneca, Novartis, Bristol Myers Squibb, Roche Canada, Janssen, GlaxoSmithKline, and Merck. We also would like to thank Jerry Jeffcott and Alex Kirakowska from 360 Public Affairs for their kind donation of time to facilitate the observer groups. Without all of your generous support, we would not be here today. Also, thank you to Pfizer for printing the World Economic Forum report for us. It's all in your pamphlets there. Special thanks go to the steering committee for the event. Louise Binder, Antonella Scally, Chad Scanlon, and Jackie Manthorn, Rose Tong, Lee Stevenson, and Sophia Wertheimer, whom we also thank for facilitating for the next 2 days for us. Thank you to Leah Lapola for her administration support, and Joanne Harabas for our amazing note taker at the back of the room. Thank you, Matthew Broham, Wayne Critchley, for presenting the 2 introductory webinars to this summit. Thank you to the 2016-17 Drug Pricing Policy Working Groups that are also listed on the presentation slides, who will report back on their work last year a little later on today. Thank you to our small group facilitators, Ron Rosenass, Rose Tong, Lee Stevenson, and Sylvia Urbanek. Thank you to Amanda White from the Schizophrenia Society for developing our program, and to Claire Laberge and Alexandra Martin-Roche for your translation. Thank you to the Japanese Canadian Culture Centre for housing us again this year, and to Oak Park Deli for catering the event. Also, thank you to our technicians, Red Tree Productions at the back of the room. Thank you to all our panelists, particularly our patient panel of Martina Elias, direct from Montreal, and from Myeloma Canada, Phil Upshan, direct from Toronto, just over there somewhere, the Mood Disorders Society of Canada, and Linda Wilhelm, direct from Redderton, New Brunswick, and the Canadian Arthritis Patient Alliance. I hope I haven't forgotten anybody. There's been scores of people helping here, but if I have, please let us know and we'll try to make amends. Again, welcome to all of you, who I'm sure will be a most informative and thought-provoking 2 days. Now over to our facilitator, Sophia.
Thank you very much, Kath, and welcome everyone. Bienvenue à ce 2e sommet annuel sur la politique des prix des médicaments. So welcome to the 2nd annual Drug Pricing Policy Summit. It's a pleasure to be here again this year. I had the great honor of facilitating the event last year, and I'm really excited to be here for a 2nd year to find out more about what's been happening over the past year and see how we're going to be working together to move things forward over the coming year. So thanks everyone for being here. I know we have a lot of diversity in the room and people who have traveled from far and not so far, but to be here, but nevertheless, your presence is greatly appreciated. Si on a des participants francophones dans la pièce ou qui préfèrent s'exprimer en français, vous êtes les bienvenus de le faire, puis on va se faire un plaisir d'interpréter pour le groupe à l'anglais. So people can comment in French or English. I wanted to just, before we hand it over to our panelists for this morning, I just wanted to run through a few items just in preparation for the next 2 days that we're going to be spending together. In terms of very practical, logistical items, for those who have not yet been to the washroom, you'll find them if you come out of the room on your left and then another left in the hallway. All the bathrooms are accessible, and for food and so on, we'll be serving all the food over here where the breakfast has been served, along with refreshments on the side. So this is where we'll be eating as well in this room. We do have a room available upstairs, which we'll be using for the breakout discussion groups this afternoon, and I'll tell you a little bit more about those as I run through the format for the event. And I also wanted to mention for Wi-Fi, the optimal network to be using is JCCC Open 14, so JCCC Open 14. And you don't require a password to access it. So that seems to be the best one to be using as guests. So I wanted to just run through the format of the event, which is similar to last year's, though we have made a few changes. And I apologize if I sound a little bit raspy and congested. I'm fighting off that cold that's been going around, so unfortunately I'm a little bit sick, but feeling good and happy to be here. And hopefully it won't affect my brain performance. It's just in the chest. But if I sound the way I do, that's why. I feel like a jazz singer with my raspy voice. So just to review the program, so we have a very rich program over the next 2 days. We've tried to combine different elements and different ways of being able to learn and to speak to one another and to engage with one another. So we do have a number of panel presentations, individuals who represent a number of stakeholders and a number of perspectives that are going to be presenting throughout the day. Throughout the 2 days, and we're really happy and honored to have them here. Some were with us last year and will be able to provide an update over the last year, and we also have some new panelists, so it's an exciting mix. Once again this year, we've also invited a number of observers, so individuals who don't represent the patient, caregiver, or patient group perspective, but that we're eager, that are still important stakeholders and that we're eager to be here with us. So we're really thrilled that they're joining us again. They're what we're calling the observer participants. And they, of course, will be in the room with us throughout the panel presentations, the Q&A, and all the group time that we have as a large group. We will have this afternoon, as well as tomorrow at the end of the day some time to work in our separate groups. So we'll have the patients, caregivers and patient groups breaking out into smaller discussion groups in this room. And we've invited the observers who will be taking part in their own facilitated discussions to meet upstairs in room 2A. So I'll give you a little bit more information about that when the time comes for the roundtable discussions. But all that to say that we're really happy to have this diversity of perspectives in the room. So this year we've also, of course, want to, this is a summit by and for patient and patient groups, and we wanted to make sure that those perspectives were included in many different ways throughout the 2 days. So a bit like last year, we'll again have opportunities for Q&A. We'll have opportunities to meet together as patient and caregiver groups to look at what has been discussed during the summit, and also to work together to identify action items and see how we want to continue build upon the work that's been done over the last year and continue organizing ourselves to move these important actions forward. This year we've also created what we've been calling our Greek patient chorus, which is 3 individuals who represent the patient perspective, who have been invited to provide some feedback after each panel, so to kind of respond to the panelists from a patient perspective. So they'll be offering these comments and these views and perhaps questions after each panel. And we'll have a chance to hear some introductions and hear a little bit more about them after the first panel. So with that, I think that covers a few of the changes with the program. But again, we have a really nice mix of activities. We'll have some chance to chat as a large group and chat in smaller groups as well. We encourage you, of course, to mix and mingle, to meet new people, to try not to sit with your colleagues, which I know can be challenging, but go out there and make some new connections and some new meet some new people. So that's it by way of the program for this year, and of course as we go through the 2 days, I'll give you a bit more information and I'll introduce you to everyone. But I did want to give a little bit of an overview. I also wanted to mention a few things. So regarding the patient folders, you've received the patient folders as you registered. They contain a number of important documents, including, of course, the program, that wonderful World Economic Forum paper that was printed out for us, which I invite you to read if you haven't done so already. You'll also find some ground rules and a document with ground rules and format. So with regard to the format, it's just a bit of an elaboration on what I was already telling you about who's in the room and how we're going to be working together over the next few days. I did want to speak to the ground rules briefly. Those were certainly not meant to be patronizing in any way. I mean, obviously everyone here has participated in summits and we all have a lot of experience with this type of group work. It was more in the spirit of keeping certain things in mind and maybe making a few suggestions just to make sure that we really maximize our time together. Because we have 2 days with a lot of activities to do and a lot of things to do over the next 2 days, and we wanted to make sure that we really maximize that time. So of course, just to run through briefly what those ground rules are, what we were suggesting, of course, is a simple one, but an important one to remember. So while there's definitely room for critical thinking, and we're here to be critical together and to see how we can work together optimally to maybe address some issues and problems with current systems. Let's just be mindful of the fact that there are different perspectives in the room and to remember that people are speaking and are representing these different perspectives. So let us be respectful of one another's perspectives and also make sure that we share the space and that we give an opportunity for everyone, including perhaps the shyer or less extroverted individuals to also share their perspectives. We would also encourage you when you're making asking a question or wanting to make a comment, first of all, introduce yourself, and if you're with a group, what affiliation you're with, just as a way for people to get to know each other and so that we know who's in the room. And if you can also indicate whether you're making the comment on behalf of yourself personally, or if you're sharing your organization's perspective or your group's perspective when you're making a comment, that would be really interesting just for us to know, and also for note-taking and so on. So make sure that you let us know who you are and also which perspective you're speaking from when you make a comment. We also wanted to speak to the question of stories and people's stories, and we know that there's a lot of very rich lived experience in the room, and that's something that's really key in moving these important actions and moving this work forward. We recognize the great value to personal experience and to people's lived stories and stories of their struggles. However, in the context of these 2 days where we have limited time together, we're really encouraging you to kind of really look at the broad level and look at policy issues and look at systemic issues as well. And if you're going to be sharing your own personal experience, if you can really frame that with regard to the system and to the systems that are in place and how your personal story can inform perhaps broader change that needs to happen at a systemic level. That would be a way to just make sure that we're really kind of keeping this broad dialogue and addressing the broader issues and not so much the granular individual issues, which are certainly important, but as we are gathered here together as a large group of diverse stakeholders, we really want to maximize our time together to talk about these big picture issues and future-looking issues as well. So with that, that said, of course, if you have some personal questions or perhaps some questions or statements or ideas that are really quite specific to your own experience or to your particular disease or disability group, we certainly welcome you to share them with us. Amongst other things, we've left some post-it notes on the table. So if you have some specific questions about your own situation or so on, please feel free to write them down along with your contact information, and we'll be really happy to either answer those questions or put you in touch with a panelist or someone who can. And same thing, if you have some ideas that come up or some questions or some thoughts that you'd like to share and maybe you don't feel comfortable doing so in front of the large group or you're not sure how relevant that intervention is at that point in time, feel free to write them down. You'll note that we've put some parking lot sheets of paper on the side, so you can go stick them on there, and we'll be sure that we'll be reviewing everything throughout the summit and making sure that we attend to all those different points. Finally, we've also, again, in the interest of making sure that we maximize our time together and that we work very effectively, again, because we have limited time and such great and diverse perspectives in the room, we've also developed a note-taking template specifically for the individuals, the participants who represent patients and caregivers and patient groups. So this is the note-taking template, prise de notes, which you would have taken at one of the front tables, a few of these loose-leaf sheets, which pose 3 questions. So I'll read them out for you. So we're encouraging you during each panel to keep these questions in mind, to jot down some notes, and they're really going to be feeding into the discussions that we have in smaller groups this afternoon. And also the discussion time that we have tomorrow. At the end of the day, we're going to have 2 hours for the patient and caregiver groups to really work together to map out what we want to be doing over the next year, and action plan and commit ourselves to different groups and activities. So we'll be encouraging you to fill out these note-taking templates during each panel, which asks, what are the top 3 issues that emerge and or messages that you will take away from this panel? The second question is, from the perspective of a patient, representative, and or caregiver, how do these issues or messages affect treatment access or other related areas? And finally, C, using a health outcomes lens, what are practical measures or changes that need to be put in place to address these issues? And we'll be finding out more about what exactly a health outcomes lens is during this first panel. So don't worry if you're not clear on that last question. You'll understand a little bit more as we move forward. But again, we encourage you to take notes on these templates. We'll be collecting them. We'll be using them as we work in our groups as well. And to us, it'll be a great way to document what's been happening throughout the summit. We basically want to develop an ongoing feedback loop as we did last year. So as the summit evolves, we'll be reporting back progressively. So tomorrow we'll report back on what happened today and so on. And really from the perspective of patients and caregiver groups. So this is a really useful tool for us to see what are some of the important themes that are emerging and what are some of the priorities that you're starting to see in these panels and from your perspective. So thank you for your collaboration with this note-taking. So I think that covers the main elements, and of course I'll address some more points as we move forward. I did want to mention, just as a last point, we encourage you, of course, to tweet or Instagram or use Facebook to kind of report back on what's happening in the summit. You'll find the summit hashtag here, DPPS 2017, and also at lunchtime we'll be sharing some tweets as well that you can, some pre-written tweets that you can use, that you can share over lunchtime as well.